City of Mesa residents may notice a new vehicle driving their streets. It's called a TRV, or Transitional Response Vehicle. This vehicle and the two-person crew driving it represent innovations in emergency medical care and response. In fact, the Mesa Fire Medical Department was recently recognized with the Excellence in Fire Service-Based EMS Award. This national award highlights an area of business some may not know the fire department provides. United Mesa Firefighters Local 2260 President Brian Jeffries explains.
We don't just fight fires, we provide high-end medical care for our citizens and have been for many years. And what we're doing is changing and growing every day.
Due to high call volumes, some units were unable to respond to calls in their area 25% of the time. So the calls were handed off to a nearby unit, increasing response times. Of the 55,000 calls in 2011, 76% of them were medical in nature. Mesa Fire Medical Department Chief Harry Beck says he and other department leaders created a new two-person team who would respond to medical calls.
The two-person response system is only sent on low-level emergency calls, so it doesn't interrupt any dispatch we would have for a heart attack or a true life-threatening emergency or a major fire or a hazardous material incident or something of that nature. So what it actually does is allows those units to stay available more often so they can get quicker to the scene of incidents.
This two-person team is made up of one paramedic and one emergency medical technician, or EMT. The two are able to reduce response times and high call volumes, as well as bring the most appropriate unit to the incident.
It's going to help advance the care of our patients, the citizens of the community, help them to receive a higher quality of care, and have the ability to remain at home when possible.
The department's medical director, Dr. Gary Smith, says Mesa is partnering with Mountain Vista Medical Center to add physician's assistants to the TRV unit. Soon, a paramedic and physician's assistant will be able to test patients for illnesses like strep throat or ear infections, write a prescription, and call back 24 hours later to ensure the patient's health. The tests and visit will be billed to your insurance at a much lower cost, saving money for the patient.
As opposed to having a $100 copay to go to the emergency department, this is a house call that has a much lower copay. And so that is something that is going to be a great benefit to the citizen. So there will be a significant cost savings to the entire healthcare dollar.
Beck stresses that if a person becomes more severely ill, they will be sent to a hospital for more appropriate care. Executive Director of the Congressional Fire Service Institute, Bill Webb, and President and CEO of Medical Alert Foundation, Andrew Wigglesworth, say they awarded the department with a national honor because of this innovative idea.
You have to look at the application process, and you have to look at who looked at these applications. It wasn't just one organization or two organizations. It was 5 organizations that represent over 1 million firefighters throughout the country. And so I think when you put it in that context, it really does serve to underscore just how important this award is.
It's a team effort, and it shows. And a team effort that involves not only management, the union, Chamber of Commerce, the mayor, the city council, the medical community, hospitals, is, again, really innovative, deserving of recognition. And congratulations, and my hat's off to this department.
City of Mesa Mayor Scott Smith echoes the sentiment.
We always knew and have always known that we have the best fire department and the best fire personnel. It's great when people outside the city come in and sort of remind us of that and recognize the fact that that's true. So congratulations to all, and we're really proud of you. Thank you.
Mesa Fire and Medical Department has 3 TRV units in service. Chief Harry Beck says the department will continue to look for advances in technology and evidence-based medical developments to provide a higher quality of care for residents despite the difficult economic times. For the Mesa Fire and Medical Department, I'm Laura Donaldson.